towards a situation like this. So, you
Uh-oh, we lost you. You
know,
disappeared.
I'm still here. So, I don't know if Tom wants to, give you some information that maybe you're not aware of, that's transpired over the years. And then, give us some guidance, please.
Well, let me ask this first, before we even, I mean, I have the same observations as you, but before we even go down that path, I mean, what are our other options? That's a big one here, because sometimes, we're with the lack of options, we're kind of stuck, right? And so I don't want to go to battle with this group if they really are the only game in town, right? I'm always willing to go to battle, but I mean, it's I'm frustrated. I don't know what, I mean, I read the contract today, same thing. I read the addendum. I mean, I do see on there where they say that they could charge an additional amount for service. Am I worried about the additional amount? No, not really. It's not that much money that it really even ruffles my feathers that much. What ruffles my feathers more is the same thing. What does it actually pay for? That's the only, I just want them to answer that. And then that invoice that says for that COVID related, okay, fine. But I'm also having a hard time with them referring to it as using Municipal CARES Act money. They don't get to determine what funding source we use in order to pay for their services. And they have no idea whether we've expended all of them or not. So, I mean, it's pretty presumptuous to just, I do feel like this is a bit of a swag, and they're looking to see if they can get a little bit of extra money from municipalities. But at the same time, I don't want to be stuck with whatever service it is that they're doing. So I don't, whatever it may be in the middle of a pandemic. So I don't know. I mean, my only recommendation is we find out what it is, just keep asking them for detail, happy to pay. I'm sure they're doing a lot of extra work. What is it? Right? And then we'll pay it. It's okay. But like, I'm not happy, even with the response to the meeting. They don't typically come to town meetings. It says right in the contract that they'll provide a representative when requested for. I mean, it's frustrating. So, but I mean, what has your experience been in the past when you're negotiating with them or whatever to do whatever?
Andy has joined the meeting, so Andy.
I apologize. I lost track of time.
That's all right.
They have attended our meetings. We have had them there physically when we've had face-to-face meetings before. This is nothing new.
Okay.
Typically, we've never really had to negotiate with them, but I will tell you back when we had H1N1, and back then they were handing out money like you wouldn't believe. And Mendon got $12,000 for that one.
Yeah.
And so when it came down to it, they said, well, we want your $12,000.
Yeah.
And the board basically said, go pound sand. And we actually worked with Trish Parent over in Upton.
Yeah.
Because back with H1N1, that was more of a hit more the kids than it did the elderly or the older populations.
Yeah.
So it was great. We partnered up, and Trish was a fraction of the cost. I mean, I don't even think we paid her $1,000 for all the clinics she did. She riled up, volunteers. I mean, she knows how to do it. And she's also public health. She comes from where we come from. So she has that understanding where the VNA is more of a business. And I mean, she held multiple clinics for the kids at Clough, at Misco, up at the high school. So that would be an option for us.
Assuming that someone like that on their own could handle the capacity of this. I mean, isn't that really the issue? Like,
but as far as contact tracing, right, yeah. And I would have to speak to Trish and to see if she would be willing to take Mendon on, and do that. My recommendation to the board tonight was actually to discuss possibly going out to bid, even just for the regular contract, because of the high amount of money they're asking for this time, starting July 1. And we don't know what those services are going to entail.
Right. I mean, that's right. Exactly. I mean, the bottom line is if we have to pay this and it is the service, fine. I'm not even fazed by that. I mean, it's a big increase over their previous contract. I get it. But in the whole, I'm working on the budget right now, and the whole big scope of whatever, we'll handle it. Not even sweating the cost, right? So that gives us time really to see if there are alternatives and to find out what the heck they actually do. You know, like, how are we going to go out to bid, right? Like, how are they going to respond to a bid if they don't tell us what they do?
I do have copies of, they used to say like quarterly reports on what they did. So we can, but we've got nothing for 2020. So with COVID, we have really no concrete anything as far as what work has been conducted. And I also spoke with the town of Northbridge. They signed the addendum with the VNA.
Yep.
But they're under the idea that it's a $3,500 one-time fee from September to December.
That was one.
Just paid them $14,000 from September to December because that's what the agreement said. So which is right?
Well, that's why I went to the lady the first time, because I was like, let me just understand what you're asking for here. $21,000? No, I just want $3,500 from your CARES Act money. I'm like, oh, well, you want some of my money. Okay, good. What for? Send me a detailed invoice, and then happy to pay it. What is it? Right. And then we got that. And so then I checked with her again today, and I said, I just want to be clear. So it's $3,500 a month, or it's $3,500 one time from January on? And she said it's monthly. So, okay. I mean, that could be for the whole entire calendar year, because they have it. COVID could go on for 3 years, and they could claim that it's related to the COVID period. I mean, it really shouldn't be up to them to decide. I mean, maybe we do a month to month, maybe we do a 3 month, with some end date, but I'm sure it's a valuable service. Somebody needs to tell me what we're paying for, right?
Without seeing an invoice telling us what they did, mop the floors, sweep the window, do whatever, we don't know what they did for that money.
Yeah.
They've pretty much been non-existent as far as we're concerned, because Missy can't even get reports when the numbers were coming down. They would stop giving us reports.
Well, that's what I'm saying. How hard though would it have even been on an invoice just to tell me that you provided services related to COVID that said X, Y, and Z? Just something to substantiate your request instead of just writing COVID on a piece of paper. I mean,
even doing roughly, you did how many contact tracing, how many positive cases?
Or even that you're doing contact tracing. Just list the things that you're doing.
How many times did you have to be on a call with the school nurse, for whatever, or with our fire chief or first responders? Just something other than services related to COVID.
Yeah. So what I can do on that one is we can have Eric send that back to them. That's easy enough to do, right? What services specifically related to COVID were provided before? So have the accountant bite the bullet for that, so that we can substantiate a delay in paying it, not that they have any justification. And then for the rest of it, shop around, find out. I don't know. I mean, worst case scenario, we got to pay it. Fine, we'll pay it. But I'm just saying, don't worry about that piece. That's the least of it.
Right. Andy or Tom, Alan, do you have anything? I know Tom does. I just know it.
Well, I'm thinking back to one of our meetings. I don't recall how long ago, but I remember Tom avidly saying, let's get a detailed receipt of what they do for work. And I know he's biting a hole in his lip because he's dying to say that. But because I do remember him right after that, on that saying, let's see what you do. Go ahead, Tom.
Hello, everybody. Thanks for joining, Kim.
No problem.
Where to begin? So,
Oh boy.
just to kind of go back just a little bit, Alan pointed it out and Andy pointed it out. And I believe this is my viewpoint, having been on the board now for about 9 years. There was a period of time when I first got on the board that the VNA contract that we had basically was something that we basically signed every year. It really hadn't been given a whole lot of attention. It was just something that we kind of just did. It was just kind of just I think just a part of regular business, and, maybe it should have been looked at more closely, but they were providing services, and we basically just re-upped. The financial element of it would appear to be reasonable. And then at some point, maybe in my fourth or fifth year, something came up that made us kind of want to look a little closer at what they actually provided. I can't remember exactly, but it prompted us to look a little bit more closely at the ROI based on what we were paying financially and just exactly what the services were. So it kind of started a bit of a more of a dialogue with the VNA, and I think from that we even, correct me if I'm wrong, I think we even got them to kind of add a couple of more service elements to what they had already been doing, because essentially for a good number of years, my view is that the VNA has done very well with regard to what we paid them versus the services they provided.
Mm-hmm.
And that's not a negative reflection on them. I just think for a period of time, we just didn't really actively go after it a little more, on a regular basis. So they were getting a good return on the value. They were getting a good amount of money, and for the services they were giving, I thought it benefited them. And then kind of evened up a little bit, maybe in the last 2 or 3 years, like I said, where they added a couple more things. So we kind of kept a little closer eye, so it's been a little bit more even. So from that to what we're facing now, I was just, and you kind of alluded to it, Kim, as well, I was a bit taken aback by the fact that the contract that we just signed back in July kind of came to us without any added conversation about potential added service needs, service support from a financial basis going into this contract that we're currently in. I really expected that we would actually see something or hear something to that nature, given that we're in the middle of a pandemic,
Mm-hmm.
and knowing that they were going to be providing additional services that we were well aware were not part of the existing contract. And Alan mentioned it, so I was kind of surprised that come, I think, the beginning of December, we kind of get this request for monies for support for what had been done. I guess originally it was a little bit of confusion. It was presented July to December, and then it was modified to represent supposedly just from September to this past December. So it just, again, I don't have a problem with them looking for the added monies for the service, because it clearly was an added service. I was just thought that overall it would have just been kind of something presented earlier in the process. So with that said, then I looked at the copy of the cover letter that came with the first addendum that Michelle had sent. And that actually kind of irritated me a bit more. And I don't know, Kim, if you'd seen that cover letter?
I think I did.
Okay.
Which one is that? The one that says she doesn't?
Yeah, it's dated December 14th, and, it's addressed Dear, and, starting off by misspelling the town name, she says, Dear Meaden Public Health Team.
Yeah.
And then went on to explain their position, and then kind of leading up to them looking to be getting more money from the town through the CARES Act Relief Fund.
Yeah.
But in the process, I wasn't thrilled in the way they presented their position with regard to this relationship that they've had with Mendon. And just in quoting in the first paragraph, she states, our contract has been one of longstanding goodwill faith, apostrophe on Salmon's part.
Mm-hmm.
And so making it seem like it's all been, they've been doing everything for us, and it hasn't been a two-way street. I was just a little disappointed in the phrasing.
Okay.
So that was to me, not a good presentation. And then, she was on to just explain things, because of what's happened in the previous year and, hours that have been added due to nursing support, saying that they far exceeded their monthly and annual contract pricing, which I, wouldn't be surprised. I'm sure they saw definitely an increase in their expenditures, having to take on more staff. So, and then it seemed like, it was mentioned in the last meeting last week, it seemed like knowing there was something coming from the government in the form of this CARES Act,
Right.
it seemed like all of a sudden they started seeing dollar signs.
100%.
saw-
I mean,
Saw
that's
an
exactly
opportunity.
what I think. I mean, if we
Yeah.
didn't, first, I mean, if we weren't receiving CARES funding, which we received almost a year ago now at this point, right? They're a little late to the game. If we hadn't received that funding, would they even be asking us for more money? I mean, it's hard to know, right? It's without the detail, it's hard to know. I mean, we're supposed to just take it on faith that they're doing more because it's a pandemic. I mean, these are some pretty, of course, right? Like, they're all assumptions we're making because we haven't been given any data and actually to verify their request. So, but I don't need to, I don't need to beat a dead horse though either. I mean, like, for the amount of money that we're talking about, if we can just get some detail on what they're doing, I'd be better, I'd be cool with it.
Well, the only other thing I'll mention that was kind of, and I'm just kind of surprised that this is coming from someone who is in the position that this person has.
Oh yeah, no question. I mean, very unprofessional.
Yeah,
I don't get the vibe. So yeah.
Yeah, in some of the email threads she alluded to, and this kind of burned me a little bit, was, the first one came last week, when Missy had inquired. She wanted us to share all the questions and concerns, and then states all other towns have signed the
I read
agreement
it.
to date,
So what?
right?
Exactly.
And then again, she repeats that same position in an email today where, Missy was asking if she'd be in attendance tonight, and her response was, well, I wasn't planning on attending, as I sent over the revised addendum with the billing piece spelled out.
Yes.
Now, we all saw what the billing piece referenced, so if that's her idea of spelling something out, there's a problem.
It also helped that she didn't
And then
say.
she says, moreover, there are 7 other towns who have agreed to it and have moved on. I'll be frank, and I know this is recorded, but to be honest with you, I don't give a rat's ass what the other towns are doing. And for her to say that and to do it again a second time, to use that as a basis why Mendon should just simply automatically, here you go, Michelle, we'll give you whatever you want. That just kind of set me off. I'm sorry.
That's why ideally we can find another provider. That seems to be best for everybody, right? Even if it potentially costs more, let's find out if we can do that. Because it's clear that they don't seem to value our business, right, as a customer. I get that we are a town, but that doesn't mean anything. We're still people who have expectations when we pay for a service, right? So I think that's the best path. So I wouldn't pay her anything until, one, we get more detail on that invoice. And if she gives some grief about that again, let's just hope there's another alternative. That's the best case scenario.
Well, that's what I was going to talk to the board about tonight is, I know back again when we did H1N1, the board and I were so thrilled with all the work that Trish had done for us. We were actually looking into bringing Trish on. The problem was what we were paying the VNA at that time and what Trish would want. I couldn't justify going from say a $4,000 bill to a $10,000 bill.
I can justify it. I can justify anything. Stick around.
Right.
If there is a guaranteed service level increase that we are going to be able to provide to our residents by increase, absolutely, cheapest is not always best, right? And certainly with this demeanor, now, do I want to pay double for the same amount of service? No, but I'm willing to pay double for twice as much service, right? So I think this happens. I think it's pretty common. There are always these companies that are right on the fringe that make their living off of towns like this. And I think they become complacent and they just forget that there are people who will not just rubber stamp everything. You know, we have questions and we want them answered. And then when they give us attitude about answering them, forget it, right? That's right. Not today.
So if it's okay with all of you, I'll reach out to Trish tomorrow in Upton and ask her if she's willing to take anything on in Mendon.
Yeah, and if not her, something else like that or whatever. I mean, like, whatever, you know?
My
Well,
other option would
Just so
be,
you know, I'm sorry, I was just gonna say, just so you know, Kim, and in addition to what Missy's looking to do with that, Trish, there are other options locally in the area.
Right.
In conversation, I've been made aware of other VNA establishments, two others which actually exist in the town of Milford.
Great.
So there are a variety of other groups if we're looking to go to an established group versus dealing with one individual through Trish, where we can start to look and have discussions for the next contract and see what, you know, that could potentially bring us, given that we may not feel very happy with what's being presented to us now from this current entity, that's all. So there are options.
Contract ends in June. That's right around the corner. So we
Yeah.
really need to act on it now.
Yeah, well, I'm looking at it now and I'm wondering if we don't sign their addendum, if they'll break our contract, so we might get out anyway.
Oh, there's a thought. There's a
Right.
thought.
So I'm not certain, so don't hold me to it, but I think this is a professional service and therefore we're not actually required to go out to bid for it. I think we could get a couple of written quotes and basically meet the need, certainly based upon the dollar amount. So that might help expedite the whole thing. Like if you're calling around and you're getting some quotes, basically, we might be good there. Okay.
Okay.
Cool.
I'll double check. I mean, I'm not an expert on every one of them, but I think because it's not going to be over $35,000 and it is, I think it's a professional service. I can't think of what else you describe it as, and that should make it exempt. So.
and I can also contact Cheryl Wawinski. I always have a hard time saying her name. Out of Sutton. She's a public health nurse, and she's actually dealing with Charlton and Auburn and a lot of towns. Even though it's an individual, those individual nurses also have a lot of, you know.
Yeah, find out who people are actually using and they like, then
Yeah.
go from there. You know, word of mouth is everything.
Because I
So-
do know other towns that I did talk to weren't happy about this and weren't happy about the way the VNA went about this. And we've all made it very clear it has nothing to do with our public health nurse that is our person, which is Anne, and
Yeah,
her work. It's the higher up, it's the hierarchy that we have the issues with.
and if
Yeah.
if we have to pull, wait, just want to say one thing. If we have to pull something creative, like we have to sign on to Upton's agreement or partner with them or something, I can get that done. I'm on good terms with most of our neighbors for pulling something off like this in the intermediate if we had to. Or regionalize or whatever the heck, or get a partner or whatever, just let me know.
So given what you just said, Missy, I'm just curious. If there was other towns out there that didn't like the presentation, why did they all jump on board? Do we
Because it
know?
was a lie in the letter.
Some of them, some of
That's it in a
them,
nutshell.
Everybody
Yeah.
signed it and jumped on board because we're all overwhelmed right now. And if you're asking me, can I write a check for $3,500 and somebody's going to help me with something COVID related, I'm signing that check. But me, you guys were like, no, wait.
and that's pretty much is it in a nutshell. I know when I talked to Jean over in Northbridge, she brought it to her town manager.
They
The
just signed
town
it.
manager just kind of basically signed off. When I talked to the health director in Medway today, The way they're set up, she brought it to the town manager, the town accountant signed off on it, and it was,
Yeah, because
there
it's such
really was no discussion, because if you're talking about, in the grand scheme of things, in some of these budgets in some of these towns,
Right.
$3,500 a month isn't a lot. But to us, we just don't, we look at things, we question things, and
Well, I mean, truthfully, if you guys had told me that you were okay with it, I would have signed it too. It's really, at the end of the day, I'm just facilitating the thing that you need, and that's what's happening there too. If their boards are fine with it, then they're going to stamp it and say, thanks. And I probably wouldn't have paid that much attention to it, except that it felt so much like a cash grab. And I hate that. And I'm not going to go on a rant about the school, but, I'm very sensitive about it, especially when I'm working on the budget and somebody comes for my wallet. I feel that and I respond really, so, when I read that lady's letter, I was like, oh, hell no. So,
Mr. Chairman?
1 second, please, Alan. I've been waiting my turn here.
oh, sorry.
Kim,
You can cut
I
me off.
just want to reel back real quick. You
Yeah.
had mentioned that you could contact Eric and Eric can question that to buy us some time. Is that something
Absolutely.
you will do, or is that something Missy will do?
Missy, send me over the invoice and say, hey, does this look all right? And I'll forward it right to Eric and I'll have him handle it.
Thank you. I just wanted to get some definition on that so it didn't fall through the cracks and get forgotten. Thank you.
Well,
Go ahead,
even
Alan.
if it does, they'll find us. Believe me, they want the money. They'll track us down. Right?
I meant on our part because we've got so much going on in this conversation, so I just want to make sure it was, so we get that taken care of. Thank you.
It'll be fine.
Alan, go ahead.
So just to kind of summarize, my understanding is we actually have two tasks. The first task is to, maybe through Missy, reaching out to some of her associates, we have to find someone to take over this contact tracing, or we have to sign this addendum. So that's item number one.
Mhm.
The second task that we have is, before the contract expires, we have to have some new prospects lined up.
Mhm.
And the other just point that I'll make is Kim, I definitely agree. This does look like a money grab, and just because the federal government or the state is giving the town some money so that they can cover some of these additional expenses doesn't mean that it's free money.
Right. We need this
And-
money. That's
Right, and for them, for the VNA to just make the assumption that that's how we're gonna pay
I
their
know.
additional charge is just so wrong.
Mhm.
All right, so like I said, as long as we're clear with the two tasks that we need to do, then I'm fine with proceeding in that direction. Thank you.
the other thing I also have to look into and that we also have to think about is I can't get the VNA to commit to helping us with any of the COVID clinics,
Right.
like obtaining vaccine or any of it. And that would be another, I get from Michelle, I get mixed signals. And when I talk to other towns, they're getting mixed signals. So that would be another thing I think I would talk to Trish. She's running some first responder clinics to see, and I was talking to Diane, my counterpart in Upton, and Trish is waiting to see how it's all going to shake out with this. And then her next step would be to do that grouping of the second grouping or second phase. The third one, she's not sure she can handle. And that's the general population. So I did have Ellen give me some numbers and stuff. So I was going to talk to Trish to see, would she be willing to help us with clinics? I know she wants to get into the schools and stuff too. So that'll be an additional conversation I will have with her because all the VNA is going to do is when they do decide to come back, it's going to be another contract for more money.
Yeah, it says that on it. They can basically subcontract out to do the work. So I mean, okay, well, right.
Andy, do you guys have anything else?
No? That's about it.
Well, I'll throw in one thing, just something that was put forward earlier. Would there be any consideration for wanting to put a communication to the Salmon people directly above Michelle with regard to this situation?
I would say, let's wait and see what happens when we send the invoice back.
Okay.
You know what? Yeah.
Yep, okay.
Do you guys have anything else for Kim, or are we good?
Well, I mean, since we're on the phone, if you've got 5 seconds, we could have our budget meeting right now. Since we're talking about numbers, I could justify it. Anything in there you want to talk to me about? Looks pretty straightforward.
I mean, I pretty much figured if you had any questions about numbers, you know how trash runs. My contracted price went up, the expenses went up because of the V&A. It's all pretty much straightforward unless you have specific questions for the board or myself.
No, I don't have any. I just thought if you guys can save ourselves from having another meeting.
Right?
Is it true that board stipends went up to $1,000 a piece, Kim?
Totally, absolutely. You can go right on the floor and ask for that. You know, anyone can amend the budget. It's a right.
Can we get that money out of the CARES Act?
Retroactive?
Only if you give the shots. Can you get trained to give the shots? Then maybe. We're almost out of CARES money, like just in case. I mean, I've had so many random cash grabs for that CARES money. It's unbelievable. I don't know what, it's very, I mean, interesting how many people think that that's just available.
What was the dollar amount that Mendon did get so far with regard to that?
528,000. And we got it, you know, earlier in the year. So you put in requests basically every couple of months, and they give you an amount based upon an estimate that you give them. And then you're supposed to keep track of and then eventually submit your invoicing about what you actually spent so that you can, you know, reconcile them. The problem is it's not an exact science, right? You asking for an estimate and then you're getting, so like it's fluid, but then in the middle of it, I mean, again, I don't want to say another thing, but the school came back and asked for what, $200,000 for iPads, which they got. And I was bent. So I just, right. So
Wow, they got iPads under the CARES Act money?
yeah, we paid for the 5th grade over here and Upton paid for the 5th grade over there with CARES money because you can pay for technology upgrades with it. And oddly enough, it was almost the exact dollar amount that we took out of their budget that they had asked for earlier in the year. So they ended up getting full funding for their budget, basically, by using CARES. So,
Kim,
yeah.
is that because the remote learning, the kids staying at home, that was justified for iPads?
Exactly. Yeah. So technology costs, and believe me, we bought a lot of technology with it too, are 100% reimbursable through CARES. It's the easiest thing to do because of the remote working and remote schooling. So they bought iPads. And so, okay. You know, awesome.
Now in the end, I take it once the balance sheets are settled, so to speak, if there's considered unused monies, the towns have to then expectations of it going back to the feds?
Yes. Yeah, that's the idea. So, you know, we just had to cover some costs for the police station project too with some of it, you know, so like these are things that you wouldn't, when I put my first large submissions in, the $300,000, the ones for the actual PPE and all of the gear and everything, never in my mildest dreams that I think I'd be buying iPads with it and covering costs of sanitation at the police station. And now this V&A thing. I mean, it's very, like, it's hodgepodge now. It's like, you know, and I have to keep saying it, the amount of times that the CARES Act comes up in meetings I'm in, which is, again, strange because no one ever really is paying attention. I have to keep telling everyone it's not for anything. It's very specific to categories that we can use it for. Like, none of this qualifies. So, you know, it's been weird. It's been a weird one.
The other thing I'm going to try and do is we have that local board of health meeting with Central Mass Regional Planning, and I guess they're getting a chunk of money. So I'm going to email Connor and
I saw
ask
that
him
too.
if I can latch onto some of that, because last year when they were handing out money to the local health departments, I'm like asking the VNA, do you need any? Nope, nope, we're good, we're good. That was the time for them to let us know. What do you think? What's coming down the pipe? What do you know? And nothing. So we got, for the Board of Health, we got $3,000 and that was it.
Mhm.
Because they weren't coming to me for, you know,
West.
additional staff, or, I mean, I've even been asking them, what do you think we're gonna need for an EDS site if we have to open it up? What are you gonna need? Blah, blah, and I get nothing. I don't know, or I'll get back to you, and no one gets back to me. So,
Well, what I would also do in adding to your task list is to make little notes of all these things. So when we do try to get out of our contract, we'll be like, here you
Right.
go. You looking for a reason? Here's
Yeah.
6.
this
You
is
know?
why I try to put everything in email so I have it, and it's not a phone conversation, because if it's,
And even if it is, I mean, you know, they got to increase their service level. That's period. Whatever that service is.
Yep, I agree.
Okay. Anything else for me? You guys good?
I'm good.
I'm good.
All set.
Okay.
Uh,
right.
the only thing I have, Kim,
Yep.
is, the Board of Health has had discussions. The world of trash is changing. And I know there are some area towns that have discontinued because of the expense. So it's something the board is working on, but, recycling is getting very expensive, even though it's a requirement.
Mhm.
So, we've been working very hard to try to keep it under control. But we don't know for how long we're gonna be able to do that. Just a heads up.
Okay. Well, that sounds like fun. Really?
Kim,
Yeah.
Kim,
Yes.
I know you have a busy schedule next Wednesday. Our contact at EL Harvey, his name is Mike Sussman. I think you've met him before. He is going to be on our meeting, and he's going to bring a wealth of information about the changes that are coming our way. If you would like to join us again,
Yeah,
just
sure.
so that
Just remind me, and as long as I can be home on that Wednesday with a glass of wine with my camera off, I'm in. I love to listen to a trash talk. That sounds delightful.
Oh, I love it. It's going to be a substantial financial change when this comes around. We do have 2 years available to us to sign, but it's coming, and we've got to be prepared for it.
Okay. Well, hopefully we'll have some more money by then,
That was a good one.
I'm not joking. I mean, this is seriously how my life is
Yeah, make sure you wear your trash bag.
now.
I have your cell phone number. Don't tempt me.
I know. Yeah, don't tell me now I gotta drive all the way home. Right. Okay.
All right, thank
All
you.
right. Good night, everybody.
Night, thank
Thank
you.
Thank you.
Thank you, Kim. Good night.
Welcome.
So did we go over the budget?
I went over it with you guys last week. The only thing
Okay.
that I did
Remember,
add,
AJ, you were trying to follow along?
No, I remember that. I meant just now when she asked.
that
She
was
wanted
it.
to go over the budget.
That was it.
Okay. Okay.
Because she pretty
I couldn't get a word in, so I went in the other room for a minute, so I guess I missed it. I didn't think I'd missed that much.
it was very quick, because she pretty much I mean, I keep her kind of in the loop as far as like when that $17,000 came up. I told her
Yep.
about it. She pretty much knows with the trash. A lot of it, they're going to get a lot of that money back because we will raise the fees to cover the costs. So our budget, even though it's a big one for town hall, it's very easily explained.
Okay. Very good. That's it for
The
tonight,
only
right?
question. Yep.
Go ahead, Alan.
When's our next meeting?
Next Wednesday, the 20th.
Okay. And, we're gonna discuss, Danielle coming on board and where she's at as far as getting her paperwork in?
Yep, I've already reached out to the HR, Tanya, and she's already sent it to me. I've already sent it off to Danielle, and I gave Ellen the town clerk email address so she could forward her the ethics training stuff. So we're
All right.
working, we're getting
good.
there.
All right, good, because I know AJ's anxious to get her on board.
Yep, I think we all are. I'm excited.
Yes, yes. Tom, you still here?
I am.
Could you had mentioned just now that you have found other entities that can give the service that VNA does. Do you, by any chance, have a small list of available companies or anything like that that you could get to Missy so we can start reaching out to see what's out there?
Two right off the top of my head. One that was highly recommended. It's called Preferred Transitions Home Healthcare.
Okay.
They're located in Milford.
Preferred
Are you,
transition, what?
Preferred Transitions Home Healthcare.
Healthcare.
And the other one that was mentioned in Milford, it's called Complete VNA.
And these are both in Milford.
Yep, both in Milford.
All right.
And there are others, but I just said those two were provided that were most closest to us.
where, just out of curiosity, how did you find these, Tom?
Through actually Jean, and what she does at the hospital, the case management team has contact with various VNA and VNA-like home health care facilities.
Yep.
For different services. She said they've been very high on, specifically on the Preferred Transitions location. But she had also mentioned Complete, and she mentioned one out of Worcester that they've had very good relationships with. And when I say good relationships, meaning that, you know, they seem to be very responsive to the needs and to the, you know, to the patient's needs and whatnot. So the case management teams within the hospital are in a good position to kind of lend some input in terms of their experiences and how things kind of go down and the services they give to their patients and whatnot. So that's where this came from.
Excellent, thank you so much. You have
Sure
those,
thing.
Missy?
Yes, I do.
Excellent, would you please reach out as soon as possible?
Tomorrow morning.
Thank you,
Not a problem.
great news. I hope we can find somebody to just equal service that's more professional, more responsive to us, that we can deal with, hopefully.
Well, I think the one thing, and we may not have highlighted it enough for Kim, was, and I think we're all in agreement, at the boots on the ground type of thing, I've been extremely happy with Sam and VNA, specifically Ann Labonte. She's been fabulous. So
Absolutely.
that part's been great. It's just unfortunate. This is really coming down from the administrative level of the organization. And, you know, whether or not ownership is pushing this on the senior administration, I guess that's kind of the unknown. But, you know, when the time comes, you know, whether or not we decide we want to, you know, put some letter out to the actual Salmon family, if we're looking to maybe make a move and highlight reasons why we're looking to make a move, it'd be interesting to see what kind of return feedback we get at the appropriate time.
I think we're all in agreement with most of what you said, Tom. Ian has been very responsive, helped Alan out recently, Alan had a good experience, got things taken care of. Resident was satisfied, everything's good. Again, like Kim stated, like Missy has stated with other towns, when this package was given to the town's administrators, they signed it, no problem. We are willing to do that. We just want some clarity. We want some show me, you know, let's see what you're doing. Don't The generic bill that they sent was so embarrassing. I mean, as someone who's self-employed, I have never, and I'm not very computer literate, or I don't have the gift of gab with the fancy words and all that as you do, putting stuff together, and it just blows me away that that's what they sent for a response.
Well, I did feel comfortable a little bit when Missy had commented on, in some follow-up conversations she's had with some of these other towns. It seems like the folks within the BOH ranks, there was some questioning going on, but when they took it to their upper management or the person that actually gives the sign-off, they decided to go with it. So at least I was just initially disappointed that it seemed like the local boards of health were not, they were just kind of willing to do it. So I feel a little reassured that within those ranks, at least there were some other towns that were raising some questions. And I understand Kim's point, from the standpoint of coverage. We don't want to be caught with our pants down, so to speak. And yes, this is money that's coming from the government. But, so sometimes it tends to be okay, well, we got the money, let's just do it, make sure we're covered, and we're in a good position for our residents. So I get that part, but maybe I'm just sometimes maybe too conservative, but I just like to watch out for, how money's spent, that's all.
Not at all, Tom. That's exactly what all four of us, actually Kim now too, since she's been enlightened about this, is all five of us. And I guarantee you, if you put it out to the town and the townspeople could understand the reason why we're questioning it, then they would be supportive also. I don't think there's any one person that says, "Oh, just pay it and be done with it." It's the right thing to do, what we're doing.
Oh, yeah, no doubt. I agree.
Well, look at, when you hear $528,000, you say, wow, that's a good chunk of dough. But look how fast it's going.
Yeah, exactly. For iPads.
School tags.
Almost half of it,
school
iPad.
tags. Yeah. And then it doesn't take long to go through the rest if everybody feels as though there's money available. What's the problem? We have all
we all know
be
reality.
accountable.
In some way, shape, or form, as taxpayers, we're going to be paying for this somehow, or our children will be paying for it somehow.
Absolutely. There is no free money.
Yeah.
Kim, Missy,
Yeah.
do you by any chance have any insight? Do you think have you heard anything to more money coming from the government coming down the road eventually? Because as Kim stated, that was almost a year ago. Is there more plans for relief from the government?
Maybe I haven't heard anything, but with the new administration coming in next week, that could all change. I don't know.
Okay, very good. All right, I think we've handled all of it, unless anybody else has any concerns. Alan?
No, I'm good. Talk to you next Wednesday.
Thank you, sir. Tom?
Nope, I'm good. I'll motion to adjourn.
Thank you, sir. Alan? He's gone already.
No,
I heard a second.
that's all right. Put me down as seconding
Second
anyway.
the motion. I'm still here and you're talking about me.
There you go.
I heard somebody say second. It sounded like a voice I've never heard before.
That must have been my dog.
That's it. Yeah, did it again. Missy, do you have any other comments?
Nope, I'm good. Thank you.
Thank you, everyone. Have a good evening.
Good night.
Good night.